Hi, I'm Dr. Will Holdsworth, your San Jose chiropractor from Pain Relief Chiropractic. I wanted to talk to you today about headaches. There's different types of headaches out there, and I'm going to focus on tension headaches and migraine headaches. The American Headache Association reports that there are 40% of us experience episodic headaches on a regular basis. 3% of us experience chronic tension type headaches, and there's actually a 5-to-1 ratio between tension type headaches as opposed to migraines. So let's talk about tension first because they're more common. We have tension headaches are basically caused by like an ache or like a tightness of muscles at the base of the skull into the neck. They can actually get so tight that they'll irritate the nerve roots, which will cause like a radiating pain, kind of like sending a whole signal all through the head. Also can cause some numbness as well because they can be so tight. Triggers are usually stress, also poor posture. That can cause some muscle strain to the area, and even just anxiety in general. For migraines, they're a little bit different. They're way more intense. When you get a migraine, you can even be completely incapacitated. You can't even get out of bed. With a migraine, you're going to get it more on one side of the head rather than both sides, like you can get with a tension headache. You can even get nausea and vomiting associated with the migraine. There's auras too that can be associated with this. The aura is basically associated with like a bright light, or it could be like a sound or like a ringing noise that can occur. The other causes of the migraines can be all kinds of stuff: sleep, stress, injury, like a car accident or sports injury can be the cause of these things. So, you know, concussions and stuff too can be causes of these headaches. The triggers for a migraine, though, there's triggers for migraines too. Triggers could include caffeine, chocolate, citrus fruits, cured meats. My notes are falling. That's okay. We'll just hold it up. The dehydration can be caused by migraines. There's so many different triggers like depression, skipping meals, dried fish, dried fruit, exercise that's a little bit too excessive, eye strain, fatigue, where it's just like extreme fatigue, you're not getting enough sleep because you're so stressed out. The food additives that may be out there, nitrates, nitrites, MSG. There's also bright light, flickering light that can cause this issue, the trigger of a migraine. Menstruation, some medicine. Sounds like almost like I'm doing like a pharmaceutical ad with all the side effects, but seriously, this is the tons of triggers for migraines. So you have to be careful because there's so much of this stuff out there: nuts, onions, stress, altered sleep, TV, red wine or alcohol. Even the weather can cause a migraine to be triggered on. What I want you to take away from this, really important, is posture is going to be one of the key things to help with your headache, especially with these tension headaches. Every inch you go forward with your head, with forward head posture, which is usually caused by looking down at something like your phone or being on your computer and looking forward like this. Even when driving, I see people putting their neck out quite far. Every inch that you go forward is going to add 10 pounds to your of the load into the neck and upper back. Your head already weighs 12 pounds. So imagine adding 2 inches. You're now at like 42 pounds of weight. Is that math correct? I think so. No, 32. Sorry, 32 pounds of weight into the upper back and the neck. Research shows the best thing you can do to take care of a headache is actually chiropractic. Chiropractors do multiple things to help with headaches. We'll do an adjustment into the area. We'll do a lot of muscle work on any of the tight muscles, like using ART or some Graston, MRT as well. It's just soft tissue mobilization and manual therapy. You can also get a little bit of nutritional support from us that will help you out with for your headaches. The one thing I like to focus on is home care exercises. Give my patients all kinds of home care exercises, usually through the videos and just talking to them. You can do foam rolling, trigger point therapy, ice for the area, even supplements and stretching. So that's it for me. That's pretty much a full-on synopsis of headaches, focusing mostly on the tension type headaches and the migraines. I'm Dr. Will Holdsworth, your San Jose chiropractor from Pain Relief Chiropractic. Thank you for watching.